from Louisiana's home team. This is Fox 8 Morning Edition at 6 a.m.
Okay, thanks a lot there, Christy. If you're worried about your bones becoming really fragile as you get older, you're not alone. Dr. William Junius joining us now to talk about preventing osteoporosis. Thank you so much for coming in.
Thank you.
You are with Peoples Health, right?
Yes.
Thank you for coming in. Explain for people who are not familiar, what is osteoporosis?
So osteoporosis is a disease of bone whereby patients lose bone density and makes them more susceptible to fracture.
And as we get older, what are things we can start doing to prevent that?
So the first thing in prevention is the proper diet. Things like vitamin D and calcium help patients to maintain the bone density that they already have. The other things are exercise, maintain a healthy body weight. The other things are muscle density, muscle mass, to ensure that the patients have the adequate strength to move around properly. Probably one of the most important things for patients is to avoid falls, and that is to have a good, healthy, clean environment around the house, no clutter on the floors. Those are probably the best things to do for osteoporosis.
You can get them, the supplements and vitamins. So what are some foods that would have, you know, the C and the D that you should be having more in your daily foods?
So the biggest thing that has vitamin D and calcium would be things like dairy products, milk, cheeses, yogurts, those types of foods.
And if you're lactose intolerant, then what do you do?
Probably at that point, the best thing to do would be to take a supplement.
Okay, because overall, I mean, I guess the message you're trying to get across, people may not think they have time to do all of these things, but what are you risking as you get older, like in terms of your daily body, what you'll feel like if you don't take care of that in advance?
Well, so the thing about osteoporosis is that there's no pain associated with it. It's a silent disease. And me as an orthopedic surgeon, the most of the time that the patients finally see me for osteoporosis, they've had a fracture. So from our standpoint, we're not so much on the preventative side, but I see the patients after they've broken a bone, such as a hip or a wrist or their spine, and that's, of course, what the patients really want to prevent.
Okay, some good advice, so you don't have to deal with that later on. Thanks a lot, doctor, for coming in.